If they end up in your skin, we would call that eczema. If they end up in your sinuses, we might call that chronic sinus disease.
I'm super excited to be having this conversation around T2 inflammation. For those who don't know what T2 inflammation is, it's okay. We're about to discuss it right here, right now, especially with Dr. Chase. Wait, yes! Dr. Chase, thank goodness.
Hey, how are you?
Good, how are you?
I'm great. I was waiting here trying to join, but it said that, it was just going to be fussy today.
Yeah, and that's okay. This is technology for you. I'm just happy that we made it work and that we are here and
Yeah.
we're having this important conversation. Yes, Darla, it is a success. Thank heavens. All right, Dr. Chase, why don't you give us a little bit of a background of who you are and what we'll be talking about today?
Okay, sounds good. So I'm Nicole Chase. I'm an allergist, immunologist, board certified. I see both children and adults. I practice in the Minneapolis-St. Paul metro area, and I'm super excited to talk about all things inflammation, specifically type 2 inflammation. So I'm your woman for tonight.
Yes, thank you. And we're so excited to have you here. And for those who may have missed it, I am Ann Lora. I'm an eczema patient advocate. I have been living with eczema for over 30 years now, so very long time. And I have many types of eczema, one of them being atopic dermatitis. And so because of this lag situation, I'm just going to jump right in, Dr. Chase, if you don't mind. Let's start off with the basics. There's a lot of people in the community who may not have heard of T2 inflammation. From your perspective, what is it and what conditions can cause it?
Yeah, so T2 or type 2 inflammation is really kind of the body's exaggerated immune response to normal things in the environment. So whether that be pollen or animal dander or even your own body sometimes. And the way I think about it is that you have these allergic cells and allergic chemicals that float around in your bloodstream. And really, depending on kind of what your body type is or what your predisposition is to certain disease, if they end up in your skin, we would call that eczema. If they end up in your sinuses, we might call that chronic sinus disease. And so really it's the same condition, just in different forms throughout the body. And we really learned so much about this over the last 10, 15 years that we find that these conditions, really there's a lot of overlap and they're really, really similar actually.
Okay, amazing. And I know a lot of people here that are currently viewing are living with eczema and atopic dermatitis. So how does T2 inflammation show up in someone who is living with atopic dermatitis, also known as eczema?
Yeah, so things that you might see would be, classic features of inflammation, which might be redness, might be some degree of swelling. Commonly, these conditions can have other symptoms like itching associated, but it really depends on the disease state. If we're talking about the lungs, it might be asthma or COPD, and with those, you might see more classic kind of wheezing, coughing. So it depends where we are in the body, but really the underlying processes are always the same.
And as somebody who is living with atopic dermatitis, are we more likely to have other T2 conditions?
Yeah, 100%. So I would say that the majority of patients that have one type 2 inflammatory disease or atopic disease, as we call them, probably, above 60, 70% of patients would have another, whether that just be, seasonal allergies, whether that be asthma, nasal polyps, et cetera. We talk about a lot this atopic march, which is that when you're very young, sometimes we see eczema and then we see maybe food allergy. And this really is a progression throughout your lifetime. So going from the skin to, let's say, the sinuses or the eyes, and then sometimes going to the lungs or even the esophagus where you swallow. So we know that things can progress in different ways for different people, but yeah, super, super common to have overlap.
Yeah, and I'm sure I'll just speak from I have the overlap. I was diagnosed with atopic dermatitis as a baby, and then shortly after got asthma, and then really lived through allergies. So that triad there is very common within the eczema community.
Yeah, your body read the textbook for sure.
Yeah. Okay, just moving right along. We see a lot of commercials around biologic treatments now, right? And so when do you consider a biologic for someone with atopic dermatitis, and who do they tend to help the most?
Yeah, it's a good question. So we have some biologics now that are basically approved for patients that have moderate or severe atopic dermatitis. So once you're thinking about patients that have tried some of the usual topical therapies, whether that even just be bleach baths or wet to dry wraps, definitely topical emollients, topical steroids, or calcineurin inhibitors. Once you start thinking about the patient that's either using a lot of those and still has symptoms, or just has a very large body surface area, or even has more sensitive areas of their body that are affected, like hands, face, etc., where some of the treatments are more limited, those are the patients where I really would think about offering them a biologic. And nowadays, we actually have some biologics that are FDA approved all the way down to 6 months of age. So, you've all seen the little babies that are just kind of one big rash. It's really, really heartbreaking. And so now we're really able to help those patients and, maybe even kind of intervene in that atopic march as well. We're waiting to hear more about how that all pans out.
Yeah, it's definitely an exciting time to just be in this space where there are so many treatments for people living with atopic dermatitis and other T2 inflammations. So I'm
Yeah.
just going to switch gears real quick and talk a little bit about another type of T2 condition known as nasal polyps, which many people here may not be familiar with. So I would love for you to just give a brief intro to what that is, and then also just what causes that and how does somebody might have it? Like, how do we know that we have nasal polyps?
So nasal polyps are basically associated with a disease called chronic rhinosinusitis, which really just means inflammation of your nose and then the sinuses in your face. And the concept is that with that inflammation, a lot of people will have congestion or stuffiness. Frequently, they'll have a lot of mucus production that can drain down the back of their throat. So a lot of throat clearing is common. One of the things that nasal polyps kind of add to the picture, they're like these grape-like structures that just form inside your sinuses. And with that, it's really, really common for patients to have kind of a loss of sense of smell, which can often lead to a loss of sense of taste. So if you're really, someone that's really congested, always clearing their throat, really just never is the first to smell, food cooking or things like that, this might be someone that actually doesn't have just usual allergies or a cold. Maybe they actually have this sinus disease with nasal polyps.
Yeah, and I can definitely see how someone might not realize that they have a condition like nasal polyps because some of these symptoms can be just misdrew to be allergies or just part of a seasonal thing.
Yeah, it's really, really common for people to come in and have no idea that they had any of these. I mean, sometimes gigantic tissues inside their sinuses. What we do know is that in some patients, actually, it'll be first shown that they actually have sinus disease because their asthma will start to flare. And if it's just a little bit out of proportion, we'll be like, what else could be causing this? And so we always think about the airway as just one big respiratory tract. And so maybe it's actually the sinuses that are the issue.
Okay, so good for our listeners to just hear this and just see, hey, do you have some of these symptoms that Dr. Chase is mentioning? And if so, please be sure to connect with your doctor on this. And how do doctors usually treat nasal polyps? Since they are T2 related, can biologics help?
Yeah, absolutely. I mean, now we're in just this era where we used to just give oral steroids or, nasal steroids to patients. We put steroids into their sinuses as little plugins and things. And now basically we have the ability to block some of those cells, some of those chemicals that are naturally occurring in the body, things like IL-4, IL-5, IL-13. And basically by giving someone a biologic injection that might block one of those, such as dupilumab or omalizumab or whatnot, basically we can actually stop the progression of disease and even cause some remission. So people that have a certain degree of nasal polyps, we've seen patients where we actually give them this treatment and their polyps actually go away. They have less of that stuffiness, they have less of the drainage, and then they really, some people very, very rapidly actually experience improvement in their sense of smell, which is just so, so amazing, especially when you just take it for granted that things don't smell a certain way. To have that back, it's really, really remarkable for patients and so much fun to hear how they're doing after we start them on biologics.
That's amazing to hear. I did have just a listener in here who said that she had a sinus surgery when she was 17 years old, somebody who also lives with atopic dermatitis. So it seems like it could be a little bit more common, maybe than people may think or assume.
Absolutely. I mean, I've seen patients as young as 11, 12 years old that actually have sinus disease with nasal polyps. And, there are lots of things we want to make certain that we rule out in these patients, but it's not unusual for someone if they otherwise have a family history of allergic disease. And that's really the nice thing about these type 2 conditions is, it's not like you didn't see them coming. I always tell people, your parents gave you lots of other nice qualities, but it just so happens that this is also part of it. So usually if we have a family that's atopic, we kind of are already thinking about the kids as being potential candidates for intervention in the same regard.
So grateful that we're having this conversation. And I'm going to jump into some more questions, but in the meantime, for those who are listening in, please drop any questions in the chat that Dr. Chase or I can support you with. So just moving right along, what advice would you share for someone with atopic dermatitis who doesn't get relief from creams or ointment?
Yeah, I would tell them that, look, we're in the halcyon era of medications. You do not have to suffer through, applying things twice a day, multiple layers, that really there are options for you. And some of those options are as easy as, an injection every 2 weeks where you could just kind of set it and forget it. There are lots of different things that are available right now. And so it really depends on the individual patient, what would be right for them. But I would highly encourage them to, look into the, different communities that are available, advocates like yourself, but really speak to their doctor and just kind of say, I've heard that there may be more, like, what can you offer to me? I think sometimes doctors are really great at just refilling prescriptions. And unless you actually bring up the issue, it may be that they otherwise just think that you're happy with the status quo. So speak up, be your own best advocate for sure.
And I just want to plus that, Dr. Chase, it's so important for people to know that there's more than one option out there that exists for them to really support them in managing their eczema on a day-to-day basis. And
Yeah.
as I mentioned before, we are living in amazing times. These treatments were not available years ago when I was diagnosed with eczema. And so I'm just grateful that we have more and more options out there for people these days.
Me too. I love giving people choices. I always tell them, look, I work for you. I'll meet you wherever you are. But at the same time, like, let me give you the buffet of choices here, and
Yes.
then let's work together to knock this out of the park.
Yes, that is so important. And is there anything you wish more patients knew about eczema or nasal polyps?
Yeah, I really do think it's important for people to know that these are conditions that we used to not have very much to offer. And it used to be that, yes, there was a great deal of suffering associated, but at this point in time, you shouldn't be suffering with either of these. And also, if you kind of ever wondered, is this maybe related? I would say absolutely, you're on to something. Like, trust your own instincts and really push your providers to be able to give you that information that you deserve to hear about in terms of what else might be out there for you.
Yeah, no, that's amazing. And again, it goes back to just making sure that our listeners here and anybody who is watching this afterwards know that there's options out there and to be curious about any symptoms that may arise. Let's just not assume that it is eczema. I do have a question here. Social Queen Darlene says, I have had itchy skin for 7 years now and have been given every topical steroid cream you can imagine. I've been having my most horrible flare this summer, and finally a dermatologist prescribed Dupixent. I took my
Hmm.
first shot last Friday. How soon should I notice a difference?
Wow, that's amazing. I think in general that I can't give any specific medical advice. I wouldn't want to for sure, but I do think that, eczema is an interesting condition. We think about it as having kind of an acute phase, so maybe more short term, and then we also think of it as having a chronic phase. So I definitely would say that when I consult patients, let's say about Dupixent, I tell them, look, let's just try and agree to try this for the first 3 months and see how it goes. Not only in terms of your skin and really how it's feeling. We know that itch sometimes can get better very, very quickly, but sometimes it takes longer for the skin to heal when it's been such a chronic condition. So I usually tell patients, like, let's follow up at 3 months and see, like, are you tolerating the injections okay? Have you been able to access the medication? Like, what questions do you have? And then usually we go from there. But many, many patients will say that they can tell that things are different. Their itch especially is getting better really, really quickly. So hang in there is my advice to your follower.
No, thank you so much. And just two more questions here. How do you know if you just have allergic rhinitis or if nasal polyps might be causing your symptom?
Yeah, it's a good question. So, when I think about allergic rhinitis, I really think of the classic like itchy, sneezy, drippy nose where it's coming from the front almost like a faucet. Whereas with nasal polyps, it's really about that chronic inflammation and obstruction. So, congestion, the drainage down the back of the throat and the throat clearing, as well as that classic like either decreased or loss of sense of smell or taste. If you have those, I think even if you might also have allergic rhinitis, you should absolutely be evaluated and have at least an examination to see if there is evidence of nasal polyps, and if not, to see if there's evidence of just chronic sinusitis alone.
Great, great response. And just going into that examination just a little bit further, there's somebody who asked, how useful is a biopsy to help determine or select the right or best biologic or treatment for you? And is a biopsy not useful? Like, what does that look like?
Yeah, so I mean, I'm not an otolaryngologist. That's usually who would be doing the biopsies, but I would say that in my experience that no, a biopsy is not necessary. I mean, there are definitely other conditions that can cause sinus issues, and so we always want to make certain that we're treating the right disease state. But if you actually have chronic sinusitis, if you have evidence of nasal polyposis, right there for the most part, we really are able to decide and make a clinical diagnosis. Sometimes there will be laboratory studies that will want to verify, and if tissue, let's say, is removed, we'll look at that. But at the same time, no, it doesn't guide the choice of biologic. There's actually really great data about biologics that are available for sinus disease with polyps. And so we oftentimes just defer to that and use the biologic that's most effective in most patients.
Amazing. Well, I just want to say thank you, Dr. Chase, for joining this live. Thank you for everyone here who came in, who participated, who asked questions. Thank you for your patience in the beginning of this live. I really, really appreciate just having this important and educational conversation with myself and with the community. I do want to lastly say that this live will be placed in my Instagram feed, but as well as posted on Vindico's Medical Education's Instagram and YouTube pages. So you can absolutely rewatch this if you need to. And just thank you again for having us.
Thanks so much for having me. It was great chatting with you. I hope to see you again.
Thank you. Likewise. Bye, everyone. Have a beautiful day. This session was developed by Vindico Medical Education with educational grant support from Sanofi and Regeneron Pharmaceuticals. More project information can be viewed in the link in the comments.